All right, so I want to close this evening to promote a little bit of a plug for research. Not only research in cystic fibrosis, but also there's a lot of research being done on chronic pain and pain with cystic fibrosis. So this lovely organization who's sponsoring us tonight does a lot of support with research. And unfortunately, I'm not going to try my luck at this next video vignette, but the URL is there if you want to go. This is a young woman with cystic fibrosis who participates in cystic fibrosis studies on a regular basis. And she has a lot of good words about the treatment outcomes that she's experienced, but also a feeling of gratification and self-importance, essentially, for the contribution that she makes as a study participant. And so I encourage all of you out there in the audience today and family members that might be listening to look in your community, do searches on the web, as well as a search of the organization in front of you for research studies that you may be able to participate in. In my research, I came across this website for the University of Alabama in Birmingham, and they have a very nicely laid out website, and it actually goes over all of the information that I discussed with you today regarding general pain information, pharmacological treatments, medication treatments, non-pharmacological treatments, complementary treatments, and also pain research links that you can get involved with if you have interest. And they also have a very nice CF interactive chat room. So I encourage you in your free time to take a look at that website. So that's all I have for today. I want to thank the audience for being so patient with us in our technical difficulties, and open up the questions to anybody in the audience or at home if there's more information that they're interested in.
Some of our patients complain of pleuritic pain.
Yeah.
Can you talk a little bit about that?
So pleuritic pain is that chest wall pain that we talked about. So it's the very classic pain that we see in patients with cystic fibrosis because of the chronic inflammation. So that can be a type of pain that we call neuropathic or nerve pain, or nociceptive musculoskeletal pain. So it's a combination of both. And so what's really important to manage that pain is not only the non-steroidal anti-inflammatories, the ibuprofen, the Tylenol, but also stretching. Those are that type of pain can also be treated with those trigger point injections that we talked about. Any other questions? All right, well, thank you. Oh, sorry, one more question.
Because of their osteoporosis and osteopenia, they're more inclined to getting fractures.
Yes.
When they're admitted, we do very aggressive respiratory therapy. However, prior to them coming in, when they're at their sickest, they can cough so hard, they can have a spontaneous fracture.
Yeah.
What would you recommend them doing?
All right,
for their pain management? Because I know typically they would get a chest x-ray for further evaluation, but would there be a special kind of pain management you would utilize in a chest fracture, a rib fracture?
A rib fracture. Unfortunately, rib fractures are very painful and very difficult to treat because they don't respond well to surgery, and there's not a lot of good surgeries that you can do for something like that. So it's really a conservative management. And in a patient that has compromised lung function and breathing ability anyway, it can be incredibly painful. So for a patient like that, I would definitely, if it's not contraindicated, recommend something like a non-steroidal anti-inflammatory, as well as regular Tylenol if they don't have any compromise in their liver function. And then looking at something like that anti-neuropathic pain medication that I talked about, gabapentin. And then for their acute pain, when they're going for treatments or anything that's really going to exacerbate their pain, possibly using a short-acting opiate, even though I know that there's the policy against it. But it can be quite effective in a short period of time for very specific pain, but very challenging to treat. And all of the other complementary treatments that I mentioned, acupuncture, relaxation, distraction, all of those in that type of a pain problem need to be brought in for best management. All right. Well, thank you very much.
I want to thank all of you for coming and everyone for joining us online. We've been listening to Tracy Malik-Searle in a discussion of managing pain, giving us some good alternatives to consider and to work with our healthcare team as we put together a structure for pain management. Join us next time for our CF Discovery Series. It will be the second Tuesday of May, and we will have a session on CFRD. Or stay tuned. Or you never know with us, but we know it will be good. So again, thank you for coming, and special thanks to Tracy Malik-Searle for your expertise. Thank you.